How does frontotemporal dementia differ from Alzheimer's disease? Have you ever wondered how frontotemporal dementia and Alzheimer's disease are different? While both are forms of dementia, they have distinct features that set them apart. Understanding these differences can help in recognizing symptoms and seeking appropriate care. Frontotemporal dementia primarily impacts the frontal and temporal lobes of the brain. These areas are crucial for managing personality, behavior, and language. In contrast, Alzheimer's disease mainly affects the hippocampus and other parts of the cerebral cortex, which are vital for memory and cognitive functions. When it comes to early symptoms, frontotemporal dementia often leads to noticeable changes in personality and behavior. Individuals may exhibit socially inappropriate behavior, emotional blunting, or have trouble with speech. Interestingly, memory loss is not a prominent early symptom of frontotemporal dementia. On the other hand, Alzheimer's disease usually begins with memory loss, particularly difficulty in forming new memories. This is followed by challenges with language, disorientation, and impaired judgment. Memory loss in frontotemporal dementia is less pronounced early on and may remain relatively intact compared to Alzheimer's disease, where memory impairment is often the first noticeable sign. Behavioral changes are significant in frontotemporal dementia. Patients may show impulsivity, apathy, or a loss of empathy. There are language variants of frontotemporal dementia that lead to progressive difficulties in speaking or understanding. In Alzheimer's disease, behavioral symptoms typically emerge later in the progression of the illness. Age of onset is another key difference. Frontotemporal dementia generally affects younger individuals, typically between the ages of 45 and 65. Conversely, Alzheimer's disease is more common in older adults, usually affecting those over 65 years of age. Both conditions are progressive, but frontotemporal dementia may advance more quickly regarding behavioral and language decline. Alzheimer's disease progression is characterized by a gradual decline in memory and cognitive abilities over several years. The underlying pathology also varies between the two diseases. Frontotemporal dementia is associated with abnormal protein accumulations, such as tau or TDP-43, in the frontal and temporal lobes. Alzheimer's disease is marked by amyloid plaques and neurofibrillary tangles, primarily affecting memory-related brain regions. In diagnosing these conditions, frontotemporal dementia relies on clinical assessments of behavior and language symptoms, often supported by neuroimaging that shows atrophy in the frontal and temporal lobes. Alzheimer's diagnosis focuses on memory impairment and cognitive testing, with imaging revealing hippocampal atrophy. Management for both conditions is symptomatic, as there is currently no cure. Care strategies include supportive measures, safety planning, and addressing specific symptoms like language difficulties or behavioral issues. In summary, frontotemporal dementia and Alzheimer's disease differ mainly in their early symptoms, affected brain regions, and typical age of onset. Recognizing these differences is essential for accurate diagnosis and providing the right support for patients and their families dealing with dementia.